Hey guys, this is Bryce Collier here with CrossFit OKC with our Sweet Fit representative, Kristen Dolph. We're going to talk a little bit about some squat therapy. So, first off, I'm going to get Kristen to look this direction. We're going to work on the perfect squat to start this up. So, she's going to have her feet about hip or shoulder width, toes slightly pointed out. Three things we're going to think about here is a midline stability. So, Kristen's going to have her abs tight and nice and extended. She's going to go ahead and stick her hands out in front of her. Keeping her weight on her heels, she's going to go ahead and squat down all the way, sending these knees out wide. You notice her knees are outside of her feet. She's got that hip crease below the knee. She's nice and set. Okay? This is the ideal squat form. This is what I want her to get to. For Kristen, when we're going to work this mobility for today, we're going to have her hold this for 2 minutes in this position. It's going to get pretty taxing towards the end of that 2-minute range. This hip will start impinging, but she'll be able to work on it. So, what do we do if we can't get this full depth? How are we going to work this? What I'm going to have Kristen do is move over here to the pole. This is assuming that she couldn't get that full depth on the squat. She's going to grab on and go ahead and lean back, keeping those same principles in line. She'll still keep the weight on her heels. She has that midline stability principle nice and tight, and her knees are still poked out wide over her feet. Okay? This is the same thing. I can get her to hold it here for 2 minutes, no matter how high her hips up, pull them up just a little bit. Even if that's as far down as we can get Kristen to go, with those three principles in line, she's going to work that hip impingement, trying to get a little bit lower and lower. Okay? So whether you're doing it sitting on your own or doing it here against a pole, I want you to work that for 2 straight minutes. After that, go ahead and stand up. We're going to work some heel cord issues. So what Kristen's going to do is stick her heel down low on the ground. Okay? And she's going to try to shove her hip up towards this pole. Okay? We're going to hold that for a minute, really working. This one's mainly going to be the calf here, nice and stretched out. It's taking big, deep breaths, holding for a solid minute. Okay? After that, she's going to come back down and then try to shove her knee towards the pole. This will be more of that heel cord Achilles tendon. She's going to hold that one for a minute, constantly trying to shove that knee in, and she can kind of move her foot back and forth a little bit, working each side of that. So, we got the squats for 2 minutes, this hip to the pole for a minute, the heel cord with the knee to the pole for a minute, and then switch and go to the other leg. And that's what we're going to do for today, working the squat. Thanks.